For my career profile number 2, I focused on the job of a behavioral health care advocate. And I found an organization in Houston, Texas that is actually hiring they're looking for 3 positions to fill. And the working environment looks great. The shifts seem to be pretty flexible, which is great. So if you want to work weekends or weekdays, it seems like they have a lot of flexibility because they're just in need. Typical stressors. It was kind of cool when I was searching for this job. I found that reviews by people that worked for United Health Group, and these were reviews made by people that were specifically behavioral health care advocates. And I was able to kind of look at the pros and cons of working for them. And some of the stressors that they reported was that they were low on staff, and so it made the job very exhausting and stressful work environment, and people were required to do more than they could typically do, and so they complained about that, and then just having a hard time balancing family life and work life. In those reviews, though, some of the benefits that they reported was that this company offers good stock and 401k. They also said they enjoyed the vacation time that it offered. Apparently it was really good. And United Health Group also allowed for promotion into other insurance companies that offer career promise. So, but one thing they didn't like was they said that their health insurance that they were offered at the time is pretty poor, so that's a downside. Some of the common job tasks, I'll just read them off, but as an behavioral health care advocate are to focus on the initial inpatient admission for psychiatric and chemical dependency patients, make patients assessments in determining appropriate levels of care, obtain information from providers on outpatients' requests for treatment, determine if additional clinical treatment sessions are needed, manage inpatient and outpatient mental health cases throughout the entire treatment plan, administer benefits and review treatment plans, coordinate benefits and transitions between various areas of care, and identify ways to add value to treatment plans and consulting with faculty, staff, or outpatient care providers on those. The educational requirements, they require that you have a master's degree in either psychology, social work, or counseling and marriage and family counseling. They also, if you were an RN and you just had 2 years of experience in behavioral health and a BSN, you'd be considered for this position. They also considered, they required that the clinical license were active and unrestricted, and they're looking for someone with a minimum of 2 years of experience in a related mental health environment. They also were looking for someone with computer proficiency, with the ability to type and navigate through multiple Windows-based systems, and they wanted someone that must be able to work at least one of the shifts that they had available, which there were a lot, so there's flexibility there. I don't know why I mentioned that. Additional preferred assets that they're looking for is inpatient experience, dual diagnosis experience with mental health and substance abuse, experience working in an environment that required coordination of benefits and utilization of multiple groups and resources for patients, crisis intervention experience, and managed care experience was a plus, they said. is cool. In the reviews that I read about this job position by those who worked there, they all said they made a base salary of about $63,000 a year. But this salary varied a lot based on experience. And for someone that is a behavioral health care advocate, the starting salary range is generally around $25,000 and can go all the way up to $66,000. Again, just based on experience. So, I was also interested as I was learning more about this career. United Health Group actually offers some positions in which you can work from home, which is something that I might be interested in. So I thought that was interesting. So thanks for listening to me ramble about, and Merry Christmas.